From Worcester, Hamden, Hampshire, and Franklin, Mr. Brewer.
Thank you, Madam President. I hope the amendment is not adopted, and I hope that the members of this Senate think very seriously and reflectively about this extraordinarily serious matter. I read the amendment, I read the final section. If at the outset of fiscal year 2015, the Institute determines that the single-payer health benchmark has outperformed the healthcare cost growth benchmark as defined in Chapter 176S of Section 5 of the General Laws, the Executive Office of Health and Human Services shall, no later than June 30th, 2016, submit a single health care plan implementation to the legislature after holding public hearings and meetings, which shall be consistent with the principles of the single health care plan, as defined in this chapter. 5 years ago, we made health care access for everyone in this Commonwealth, 99.5%. The bill that the gentleman from the Blackstone Valley, the member of the Senate President's office, has before you will save us $150 billion over the next 15 years. We employ well over 200,000 people in our health care institutions in this Commonwealth. And we want to be in here today and trying to mess with one of the few successful employer and employee institutions of this Commonwealth today. I am very nervous. I am very nervous that we would go down that road. The bill that we have proposes to do the work that we want to do to make health care affordable by working with the health care industry, not by destroying it. Number one economic engine in the Commonwealth, more jobs than in any other sector. This bill that we have, so thoughtfully deliberated for 2 years, at tables bigger than we have at Senate Ways and Means. All the parties came to that table, back and forth. If your idea hurts my entity and conversely affects you, let's talk this thing out. This health care institute that we have is going to collect data for upwards of 2 to 3 years, and they will be driven by the data that is collected, and we will go forward in that regard, remembering the Hippocratic oath of all. The first order of business is to do no harm. That is very, very important, my friends, and we need to be very cautious about whether we go down that road. We can be proud of what we have done 5 years ago under Romney Care, and we can be proud of what we have done on regulations, on making our health care system affordable for the small businesses, the regulations that have come into effect only recently to make health care more affordable. And the market forces have gone in a direction that we would like them to go into as well. But for us to meddle, and I know the gentlelady from Boston has mentioned Canada. I was ready to break out in old Canada, quite honestly. But I'll tell you what, my daughter goes to college at McGill in Montreal. I spend a lot of time there. And I go to downtown Montreal, and I see the populations down there. I go to the public areas, and they have an Occupy Canada. So you think Occupy Wall Street is the only place that has this. And you know, if you're 20 years older than I am, at 84 years old, and I fall and I break my hip, you know what their health care plan will give you? A good blanket and a pillow. Because when you're 84 years old, you're on your own in their health care plan. And when people that have wealth and have access need to get their surgeries, they come south. They come to the greatest state in the world, the United States and in the world, to get their health care, right here in Massachusetts. Let us be very cautious about what we do with this amendment today. I urge you to vote no.
From Middlesex, Ms. Jalen.